Unprecedented times call for unprecedented measures. In a utopian universe, being able to do mass and rapid viral antigen testing will expedite the process of identification, isolation, and contact tracing of potential COVID-19 patients to break the chain of community spread. However, the world is far from that reality. Today, through the efforts of Alcheon Corporation, as they respond proactively with the government's fight against COVID-19, by teaming up with reputable experts in the medical field, we are having this one-on-one meeting with one of our nation's highly credible infectious disease doctor, Dr. Daisy Tagarda. Hello, Dr. Thank you for being with us again. We are excited to learn from you. Can you please share us some light regarding rapid antibody testing and other mitigation strategies that should be in place as we try to resume operations of some establishments and businesses in hopes to reopen economy after a 2-month shutdown?
Okay, thank you very much, Doctora. Regarding your question, as related to what I have discussed in my lecture, very important is that the rapid test, even the PCR test, should be interpreted by a doctor. Never interpret by yourselves just by the result of the rapid test and the PCR, because we correlate that to the history, physical examination of the patient, and the risk factors for COVID-19. Now, more than the precautions should be practiced by the workers. First, practicing social distance, at least maintaining 2 meters away from each other, wearing masks, that all of the workers should be wearing masks, and avoid eating together, no? And then washing of hands. So make sure that the alcohol, 70% isopropyl or ethyl alcohol, is the best to be used to disinfect the hands if sink and soap and water is not readily available in your workplace. So make it more available to the workers, like placing them in the key spots in your place, like near the elevator or the area wherein people will walk often. Practice cough etiquette. So these are practical and yet very important practice that workers should always keep in mind. Quarantine once you have symptoms and seek consult of a doctor. 14 days, a recommendation by the DOH if you were not tested for RT-PCR is 14 days from the time of resolution of symptoms. So meaning, if for example, if your symptoms started on May 1 and the resolution of symptoms happened around May 7, so your quarantine will be until May 21. If you are tested for RT-PCR and it turned out to be positive, it's necessary to repeat the test and it has to be negative. Now, if the repeat test will be difficult for you to be done, then we go back to the principle of having self-quarantine 14 days from the time of resolution of symptoms.
Let's now first go to the WHO statement regarding the immunologic staining for COVID-19. When you say immunologic, it involves the antibodies, particularly IgM and IgG. Usually, during the first few days of illness, antibodies are not detected. IgG is the type of antibody which is more long-lasting in the body. This is the one being produced by the body if the patient has already recovered from the illness. And still, we have to rely on the confirmatory test, which is the molecular PCR test. The limitations: the patient is considered infectious 48 hours prior to the symptoms, up to 7 to 8 hours after the first day onset of the symptoms. So meaning that this test can actually miss the phase wherein the patient is considered highly infectious. This test is very useful when we use it for the epidemiological purposes. How much of the population has already been infected with COVID-19. These are the essential things that matter when you go back to work. Still, you have to be very, very careful. That's the new norm right now. I think, Dr. Janice, that's all that I can share when they go back to work.